Good morning, guys. Tony Maritato here. So in this video, I want to talk to the other therapists that might be watching the channel. I'm always looking for new ways to work on improving patient flexion, whether it be a post-op knee replacement or some other knee surgery, in which case the patient needs further knee flexion. And so dynamic splinting, dynamic range of motion, those are some of the things that just make life a little more interesting. So this is a setup using a traditional squat rack. What I've got two pull-up bands. The bottom one is set on the lowest possible setting. If I could set it up down here, I would. In this particular case, the lowest one is set at 18 inches. So I'm just gonna use that. I take a higher density pull-up band and I'm running it across probably, what is this? This is 33 inches where this top one is. So 18 inches, 33 inches. I know those measurements because I measure it and that's what I use for documentation. But anyway, what I do is I have the patient come close to the bottom band. I run the top band between their leg behind the surgical knee. So I've got one down low, I've got one up high. I bring the seat in. I ask them to place the higher density band right up here behind the knee. So when they're sitting, we've got the lower density band down low around mid shin, close to ankle. We've got the high density band up high, like distal femur, kind of sitting right up there behind the knee. I like the bands because they're flat, they don't get real bunched up. And basically this is just a dynamic stretch, right? So I can have a contract relax going on. I can ask the patient to extend a little bit, hold it for 5 seconds, then relax. The lower band is pulling into flexion. The upper band is pushing and supporting the leg behind the knee. If I need a little more aggressive stretch, I can have them slide forward. This could be a long duration, low intensity, sustained position. They can bounce into it. My hip is completely relaxed. Ideally, my quadricep would be relaxed. I can use a massage gun or a rolling pin or any kind of massage technique to try and feel the looseness in the quad to know that it's relaxed and not resisting against the rubber band on below. But if it's too aggressive, we just switch out the band. So maybe blue is too much, so I go to a lighter color, lighter resistance. But this would be a position, you guys can't see it, but I've got a clock on the wall. And I might have a patient just relax here for 3 to 5 minutes, upwards of a 10-minute max. They could text on their phone, they could think about their day, whatever they need to. But this is a way to get that kind of dynamic stretch. When they're finished, the chair slides back, they can stand, and then all we have to do is unhook to let them come out of position. So it's a really effective strategy, guys. I would love to see your strategies. If you have a YouTube channel, share it. If not, post in the comments below. I'll catch you on the next video.